Hello parents, myself Dr. Anupriya. In this course, we'll learn about the danger signs in a newborn which every parent should know. So first, we'll learn about what's normal in newborns. As to know what's abnormal, you need to know what is normal, right? So then we will learn about what are the danger signs in a newborn. Why is it important for you to know what are the danger signs and what to do if you see them? So first let's learn about the normal newborn behavior. So baby's feeding pattern, sleeping pattern, stool pattern, everything varies and it keeps changing. There's no one constant thing which happens, right? What might seem to be abnormal to you can actually be normal in babies. So let's learn. So first, breathing patterns. Newborns have irregular breathing pattern, that is they breathe, then they pause and then they breathe. So the normal breathing rate can be between 30 to 60 breaths per minute. Next comes the feeding frequency. So the newborns may feed frequently, maybe every 2 to 3 hours, and once they are about 2 to 3 months, then you may feed on demand, because the initial few months are important for the baby to gain weight. So you need to feed frequently. Their appetite may vary. Sometimes they may feed more, sometimes less. Then the sleep pattern. It's very irregular at first. The initial few days, the baby sleep through the day and they're awake through the night. They sleep a lot, hai na? Like out of 24 hours, 20 to 22 hours, they would be sleeping. You need to wake them up, literally wake them up to feed. By 2 to 3 months, the circadian rhythm sets in and the sleep schedule sets in slowly. Next, stool and urine output. Baby's first stool is dark and tarry. It's called as meconium. So the stool frequency also varies. The babies may pass 10 to 12 times a day or may not pass for 7 to 10 times at a stretch. Both are normal. And when it comes to urine output, at least 6 times in 24 hours is important. It indicates that the baby is well hydrated. That means you're feeding your baby adequately. Next is, why should you know about the danger signs? Why identifying them is important. As parents, you are the primary caretaker of your baby. Slightest change in baby's pattern, behavior, you will be the first ones to know. So you can pick it up early. Hence, it's very important for you to know. They are very vulnerable as their immune system is very weak. So they can fall ill very quickly and deteriorate very soon. Hence, early intervention is very important in newborns. It can prevent long-term complications. As soon as you see that something is wrong, seek medical advice. Always trust your instincts. Now coming to the danger signs. First is the breathing trouble. So first, rate. If the baby is breathing rapidly, that is the count is more than 60 per minute. That means the baby is having breathing difficulty, hence the baby is taking shorter breaths. Grunting. If the baby is making such sounds like while breathing, it means that the baby is not comfortable while breathing. The baby is taking accessory muscles ka support to maintain the normal breathing pattern. Nasal flaring, that is widening of the nostrils when the baby is breathing. Chest retractions, indrawing between the ribs or just below the rib, that is subcostal or intercostal retractions, what we call as in medical terms. Otherwise, when you see a normal baby, the baby breathes very peacefully at a rate, at its own pace. And when you see the baby is breathing very rapidly with grunting, there are retractions, chest indrawings, you need to seek medical advice immediately. Another important danger sign is cyanosis, that is bluish discoloration of the skin. You can see a bluish tint on the lips, tongue, nose, ears or the skin. You need to seek medical advice immediately. This is a medical emergency. The second one is feeding issues. Baby may have refusal to feed. The baby will consistently refuse to latch, suck or take in formula via bottle if you're bottle feeding. The baby is very lethargic, drowsy, doesn't respond, doesn't wake up for feedings. The suck is very weak or ineffective. That is, the baby is unable to maintain a good latch. Baby has vomiting. There's forceful. If it's projectile, it's a cause of concern. If it's green in color, it's a cause of concern. But if the baby is happy, effortlessly spitting, that is normal. So make sure that you're able to differentiate between the two. That is, vomiting would be forceful expulsion of the stomach content. The baby will be very uneasy. Post vomiting also the baby will be very restless. But in spitting, the baby is happy. The baby is just playing or talking and suddenly the baby spits out. That is due to the pressure over the tummy. And the baby will be happy post spit up also. Third is temperature instability. Both the extremes, that is high temperature and low temperature, are danger signs. Babies cannot regulate their temperature yet. So high fever, that is a temperature of 100.4 or beyond, is fever. And in infants less than 3 months, Any temperature beyond 100.4 is a medical emergency. It can be sepsis in babies. Low temperature, that is temperature less than 97.4 degree Fahrenheit or 36.4, is a danger sign, can be a cause of infection. So if your baby's skin feels unusually hot or cold, make sure you check the temperature and report it to your pediatrician. Fourth is jaundice. So jaundice is nothing but yellowish discoloration of baby's eyes and the skin due to buildup of bilirubin in baby's body. So the RBCs, that is the red blood cells in baby's body, breaks down very fast. The lifespan is lesser in newborns, and the product which comes out of it is bilirubin that gets accumulated in baby's body as the liver is immature yet to excrete it out. Some amount of jaundice is normal in babies. So there's a range until which the jaundice is normal, and beyond that the baby requires treatment. So jaundice in the first 24 hours is not normal, it's pathological, where the baby requires immediate treatment and intervention. If the jaundice is spreading very rapidly and intensely, you see that the yellowish discoloration is getting darker, it's very deep, you need to seek advice immediately. Or if it is accompanied by lethargy, poor feeding, you need to visit your pediatrician. Fifth is unusual behavior. So staying with your baby, slowly you learn what's the normal behavior of your baby. So anything which is unusual from that can be alarming, like irritability. Baby is extremely fuzzy, irritable, cranky. Lethargy. Baby is unusually sleepy. You're trying to wake him up, but the baby is not waking up. Unresponsive, not feeding at all. Inconsolable cry. The baby is crying high pitched, and you're trying all the soothing techniques which usually works for your baby but are not working at present. You need to seek medical advice. Sixth is seizures. That is jerky movements, stiffening, loss of consciousness, uprolling of eyes. These are not normal. Seizures need immediate medical advice, right? So at that point at home, what you can do is you can turn your baby to the left side with head slightly tilted up. This will prevent aspirations. Next, bleeding. Any unusual or excessive bleeding can be from the nose, mouth, umbilical cord, rectum. It's not normal. Swollen or red umbilicus, umbilical cord infection or the umbilical infection. There's redness, there is persistent discharge, pus discharge, there's foul smell from it. It indicates infection. The baby is not feeding well, there's fever associated with it. Please visit your pediatrician. Next is decreased urination. Urine output less than 6 times in 24 hours is not normal. That indicates that your baby is dehydrated. Baby is not fed well. But in the initial few days, that's the first week of life, the baby might pass lesser than that. But after that, if it is less than 6, it is not normal. It's watery poop. Pooping for more than 10 to 15 times a day is alarming. It can lead to dehydration. Excess weight loss, that is more than 10% of the birth weight drops. It's not normal in the first 10 days. Now, what should you do when you see these danger signs in your baby? First of all, stay calm so that you can take wise decisions for your baby. Give comfort to your baby at that moment and take wise decisions. You need to seek medical advice as soon as possible. Visit the nearest hospital immediately without any delay, or call up your pediatrician and ask what to do.